What is the debate between medical and chiropractic care all about? Have you ever wondered why one healthcare professional, chiropractic or medical, may be hesitant to refer you to another in an attempt to provide multidisciplinary treatment? Typically, the debate is all about money, as the education between the two professions is more similar than not. As you can see, both doctors receive significant training. The professions differ in their treatment options. Chiropractors offer physical medicine treatments such as spinal manipulation, nutrition, rehabilitation, and exercise, while medical doctors offer pharmaceutical and surgical interventions. As you can see, there is no specific pain management education in the general coursework of either profession, though this topic can fall under several different categories, including neurology and diagnosis. So really, pain management treatment determination is made on two primary principles. What are the costs of treatment, and how can we reduce our competition so that we can see more patients? Starting in the 1990s, pain management treatment shifted from multidisciplinary care that concentrated on disease treatment, such as what chiropractors provide, to disease management treatment, what medical doctors provide. Why? In an attempt to reduce hospital and insurance costs. The following information and screenshots are from a postgraduate continuing medical education course I attended, which was presented by Johns Hopkins Medical School. The progression of healthcare cost control. Why does the US not have universal health like most first world countries? This attempt was squashed by the medical societies between 1910 and 1915 for profit. This fight continued through the 1930s and ended in the 1950s. In the 1970s, programs that supported chiropractic or lifestyle medicine proliferated over programs that supported only temporary pain relief, pharmaceutical intervention. And by the late 1990s, there were over 100, almost 1,000 interdisciplinary pain clinics. By 2012, after the opiate epidemic started, this number was reduced to 59. Specific statements regarding this policy included that interdisciplinary treatment programs will never be a cash cow due to labor intensity. Hospitals tend to terminate services that are not profitable. And for large American hospitals, especially those associated with medical schools, revenue generation is a major determinant of what services the institution will offer. In addition, many posit that the quality of pain treatment has actually deteriorated. Now, instead of working to improve patient health, there is an emphasis to work within insurance plans, and this emphasis is on disease management, medical care, not disease treatment, alternative care. In the end, it's more cost effective to manage a disease than treat a disease. However, we found that this ideology has been wrong. The second deterrent in pain management treatment options is the business side of healthcare, an illegal attempt to eliminate competitors by the AMA, American Medical Association. Not only were chiropractors facing off against hospitals and insurers, they had to fight for survival against the AMA as well, and this was depicted in a book by Chester Wilk. In order to devalue the chiropractic profession for financial gain, the AMA developed a strategy called evidence-based medicine. This strategy implied that medical practices were based on scientific research, while chiropractic practices were based on pseudoscience. This resulted in the perception that medical doctors were superior to chiropractors and allowed for significant financial gain until the U.S. Supreme Court federal antitrust lawsuit Wilkes v. AMA started in 1976. This lawsuit continued and ended in 1990 after the AMA appealed the decision 3 times and were denied. So what does the research state about evidence-based medicine? What is evidence-based medicine? The concept of evidence-based medicine allowed allopathic or medical physicians to dominate the U.S. healthcare market while shrinking and absorbing all healthcare competitors except chiropractic. This led to the development of the Iowa Plan, and this was by the Iowa Medical Society in 1963, and the goal was containment of the chiropractic profession that will result in decline of the chiropractic profession. And remember, even though there is an impression that medical treatment is supported by research, the British Medical Journal reported in 2004 that only 6% of drug advertising was supported by evidence, and that this misinformation puts patients at risk. So what actions or steps are outlined in the Iowa Plan? Encourage ethical complaints against doctors of chiropractic, encourage chiropractic disunity, oppose chiropractic inroads to health insurance, oppose chiropractic inroads to hospitals, and Joseph Saboteur, chairman of the Committee of Quackery, said that rabid dogs and chiropractors fit into about the same category. Chiropractors were nice, but they killed people. This is what the public was told without evidence or support, but for financial gain only. Eliminate the competition. The massive scope of this methodological nature of this plan were exposed in hundreds of thousands of pages of AMA, American Medical Association documents that were brought to light in the 1976 trial Chester Wilk et al. Versus AMA, which started 1 year after the Committee on Quackery was disabled. In 1987, the United States District Court found the AMA and its partners guilty of violating the Sherman Antitrust Act. In the decision, the AMA decided to contain and eliminate chiropractic as a profession, and that it was the AMA's intent to destroy a competitor. The judge issued a permanent injunction against the AMA in this case and stated the AMA had entered into a long history of illegal behavior. However, she exonerated the two other remaining defendants, the Joint Commission on Accreditation of Hospitals and the American College of Physicians, due to a lack of evidence. Remember, the hospitals were in league with the medical societies to reduce overall costs. Why is this understanding of motive necessary? Funding allows for research. Without funding, research does not occur and policy is not made. In 2019, a leading medical journal made the following comments regarding pain management treatment options, specifically at pharmaceutical companies. Money makes the world go round. In simple terms, research will not happen unless there is funding. Medicine is always going to need pharma companies. We cannot be too brutal on them. And remember, medical doctors, teaching hospitals, and medical associations rely on this pharmaceutical funding. And when a company supports non-medical treatment services such as chiropractic, they risk losing funding. The American Academy of Pain Management, which turned into the Academy of Integrated Pain Management, was the leading pain advocate for interdisciplinary pain in the world. Their funding was cut due to negative effects of opiates and resulting lawsuits. They had to file for bankruptcy in 2019, as did the American Pain Society. Your pain management health is not driven by science, it's driven by funding. What is the truth about chiropractic? Is it safe? Does it help? An attempt to discredit a profession is why there is a perceived idea that chiropractic manipulation causes stroke. There's too much misinformation. Chiropractic manipulation, when performed by a chiropractor, is extremely safe and effective treatment option for acute and chronic pain. The problem arises when those outside of the chiropractic profession attempt to perform the service due to its known benefits for pain and function without appropriate training. Remember, after a 4-year undergraduate degree, chiropractors then take an additional 4 years of schooling to learn all aspects of anatomy, neurology, biomechanics, orthopedics, while training in spinal manipulative therapy in order to provide a safe and effective healthcare service. When appropriate and significant training and education does not occur, harm can result. In 1999, the Journal of Neurology published an article called Stroke Following Chiropractic Manipulation of the Cervical Spine. These chiropractors' maneuvers were not performed by chiropractors. In fact, they are performed by 7 orthopedists, 1 physiotherapist, 2 healthcare practitioners who were not chiropractors. In this article, chiropractic was used 14 times, chiropractic manipulation 8 times, and chiropractic maneuver 2 times. In the cases attributed to chiropractors, when actually you investigate it, it turns out to actually be attributed to medical practitioners, medical specialists, osteopaths, physiotherapists, naturopaths, a kung fu practitioner, a blind masseuse, and a wife of a barber in India. Additional documents, the AMA document by Pudum and Wu reports tracheal rupture following spinal manipulative therapy, and the chiropractor in this case was not a chiropractor, it was a blind, unlicensed masseuse at a health club. In another study by Murphy, chiropractic manipulation reportedly resulted in aneurysms of the internal carotid artery. When you actually read the article, chiropractic in this case was a barber in India. In fact, stroke due to manipulation generally falls under 2 categories. The person performing the spinal manipulation is not appropriately trained and not a chiropractor, or the stroke was causally related, meaning that a person who suffered a stroke had seen a doctor recently. But what the research states is that seeing a medical doctor actually results in a higher risk of stroke than a chiropractic doctor. Findings of a recent study showed that 1,157,475 Medicare patients who suffered stroke were reviewed. 38,138 saw both MDs and DCs. The chiropractic population in total reviewed for this study was 733,321. The medical population was 385,683. Subjects with strokes. Chiropractic visits totaled over 7 million versus 600,000 medical visits for any type of symptom not specifically related to treatment. Chiropractors, on average, people showed having a stroke after a visit, not necessarily associated with that visit, but after a visit, 1.2 per thousand within 7 days. Medical doctors were 1.4 per thousand, so they actually had a higher stroke rate than chiropractors. We found that the probability of any type of stroke on the day of the office visit was much lower in the chiropractic cohort as compared to the primary care medical cohort. And one of these reasons is possibly the prescription of non-steroidal anti-inflammatories or NSAIDs, such as Tylenol, Advil, Aleve, things of that nature, which have been linked to increased risk of stroke. One of the findings was 3 strokes per 10,000 office visits for primary care medical doctors, and they actually stated chiropractic cervical spine manipulation is unlikely to cause stroke in patients. What chiropractic spinal manipulation actually states is that chiropractic is safe. This attempt to discredit a profession is why there is a perceived idea that chiropractic manipulation causes stroke. This study found no significant changes within the cervical hemodynamics following cervical manipulation or maximal neck rotation, meaning the blood flow was not significantly changed in the arteries. It suggests that the cervical manipulation may not increase risk of any kind of cerebrovascular accident or injury or event, and through hemodynamic mechanisms. Dr. LePay, an adjunct professor of health policy from Harvard School of Public Health, estimated 1 million patients nationwide are injured by medical errors during hospital stays each year. 120,000 die each year due to medical errors, and he stated this is equivalent to a jumbo jet crashing every day. They found 1 out of every 200 patients died as a result of hospital mistakes. So the risk of having an adverse event from chiropractic manipulation is substantially lower than the risk of having an adverse event from simply walking into a hospital. So what does the evidence actually say about spinal manipulation? Roger Carey, an associate professor in the Faculty of Medicine states that there is no risk regarding chiropractic spinal manipulation. In his study, he found that 1 out of every 100,000 people risk a stroke in the general population. The risk of stroke due to manipulation is 6 in every 100,000. The absolute risk was 0.005%, and Dr. Carey states that this is not an epidemiological risk. Studies which have focused on manipulative thrust have failed to identify that the defining characteristics of a manipulation have any influence on vessel stress. In fact, chiropractic has been shown to help improve blood pressure. The American Pain Society has stated that physical rehabilitative methods such as spinal manipulation for pain management are appropriate and are essential in patients with chronic pain. The problem that occurs with spinal manipulation is when those with insufficient training attempt to perform a service due to its known pain management benefits. As you can see from this slide here, medical doctors can take a 2-hour online course through the American Academy of Family Physicians in order to supposedly learn spinal manipulation. In summary, only about 15% of medical interventions are supported by scientific evidence. This is partly because only 1% of the articles in medical journals are scientifically sound, and this was published in the British Medical Journal. So there are no double-blind studies for heart surgery, and there are no double-blind studies on the effectiveness of parachutes for skydiving. There are certain things that are simply logical, and chiropractic happens to be one of them. By looking at risk data, we can see chiropractic is the safest form of pain management treatment options. So comparing absolute risk, chiropractic is the safest. With spinal manipulation, there could be an incident rate of 1 to 3 per million. On an average year, 27 million manipulations occur, which would equal a possible incident rate of 27 total. Now, this is not deaths, this is incidents. If we look at something like acetaminophen, which is an NSAID, every year there's 6,000 ER visits, 2,600 hospitalizations, and 500 deaths per year. And 50% of these are unintentional overdoses. If we look at opiates, in 2016 alone, there were 2,861 opiate-related deaths and 16 opiate-related hospitalizations each day. If we look at surgery complications and death per year are 0.5 to up to 7%, and approximately 2 to 3 out of every 10 patients develop complications. And if we look at just general errors in a hospital, the most recent study in 2013 suggested that the number ranges from 210 to 440,000 deaths per year from simply walking into a hospital, and this increases every July by 10%. In fact, following a public health investigation by CTV News, an Ottawa medical clinic has sent letters to over 4,600 of its patients advising them to get tested for Hep B, Hep C, and HIV because of issues with improperly cleaned medical instruments. The Toronto Star reports a University Health Network dispensed unlicensed drugs that led to the development of diabetes, liver dysfunction, and death, and Washington University School of Medicine reported that heartburn drugs were linked to fatal heart and kidney disease. So when you're looking at the overall scope of healthcare, spinal manipulation is one of the safest and most beneficial forms of. And don't forget, according to Lynn Desjardins, medical errors account for 28,000 deaths yearly in Canada, which equates to the third leading cause of death in Canada after cancer and heart disease. And every minute and 18 seconds, someone is injured from unintended harm. And if you get hurt, no one is there to help. The College of Physicians and Surgeons of Ontario have been shown to underreport, lie, and cover up medical errors to protect doctors, according to the National Post. Do you think you were subject to a medical error? If your hospital medical notes indicate that an M&M or morbidity and mortality round occurred, that means you are subject to a medical error which doctors are trying to prevent from occurring again. Even though this will be in your clinical notes, good luck actually getting a copy of it to see what happened and who was responsible. Even if you hire a lawyer, in my experience, a CPSO will not release this information to you. So, how does this protect the public? In summary, chiropractic is one of the most effective and safe treatment options for general health, acute, and chronic pain.